If you are one of the 72 million Americans who are self-employed, it's time to decide on health insurance. Open enrollment is going on now through January 16th, allowing anyone to enroll in individual health insurance plans. And choosing the right plan can be a little bit complicated. So we have health insurance expert Noah Lang, the co-founder and CEO of Stride Health, here to help us out. So Noah, what is the best way to get started when choosing a health insurance plan?
Thanks for having me. My first advice is don't procrastinate. Start right now. It's January 16th to get covered for February 1st, but if you want to get coverage for the whole year, you have to do it by December 15th. StrideHealth.com can make it easier. Think of us as a much easier alternative to healthcare.gov. And I typically like to tell folks to start out with an inventory of who you are and what you need, who are your doctors, how much you expect to visit them, what prescriptions do you have, and what conditions might you be managing that you want to make sure you're covered for next year. Second thing to do is get real about unexpected events. What kind of risks could you absorb financially, and it'll help you kind of pin down a number as to how much insurance you actually need. And the third thing to do is to see if you qualify for tax credits to lower your health insurance premiums. More people than ever qualify for them. Don't assume that you can't.
What should you do if you're feeling overwhelmed, and it can easily happen with all these options?
First of all, you're not alone. The average American now has 7 insurers in their area, each with a variety of health plan options. So the first thing to do is to kind of break it down and familiarize yourself with key terms. A deductible, for example, that's how much you're going to spend before your insurance kicks in. Max out of pocket, that means you'll never spend a dime more than that. Your insurance covers everything above that. A copay or co-insurance, that's typically how much your insurance company is going to spend once they kick in post-deductible. But a number of plans, read the details. We'll actually have preset copays that lower your costs to see a doctor before you ever hit that deductible. The number one thing I do to reduce your overwhelm and make a smart decision is create an apples to apples comparison. Add your premiums, or what they might be, to how much you think you're going to spend on healthcare this year, so you actually make the right all-in cost decision. If it sounds hard, it is. That's why I started Stride Health. We can do that for you.
What is changing in self-employed healthcare plans in 2024?
First of all, the number one thing that changes every year is you. So again, zoom out, and your income is likely changed. Your health needs may have changed. The doctors you see may have changed. So take a look at your needs. The health plan you had last year might not be the best health plan for you next year. Premium rates change every year. This year, on average, across the country, premiums have gone up 5%. The good news is, so do those tax credits that you might qualify for. So you might be covered and not actually have to see your premium rates go up. The other thing is that insurers join and leave. There are new insurers in Cincinnati, and there might be insurers leaving Cincinnati. So check and make sure that the plan you had last year is the right plan for next year. And there may be new choices, new options that you can pick from this year to pick a better health plan.
Noah, this is super helpful information. Where can we go to learn more?
You can come visit stridehealth.com. It's quick, it's free, it's easy. We have advisors, we have educational content. We'll break everything down for you to make it friendly and help you make a really smart decision for your family. I'd highly recommend you do it by December 15th so you can be covered for January 1st.